Welcome, everyone, and thank you for taking time from your day to lunch and learn with us about the benefits available to seniors. I'm Carol Anderson, Marketing Director and Client Care Manager here at Generations Law Group. Today, we'll be talking about federal, state, veteran, and local benefits that you may qualify for. We have a guest panel of experts in the field of Social Security, Medicare, VA benefits, and benefits that may be available through your state and/or town's Council on Aging. Our host today is co-founding partner of Generations Law Group, nurse attorney Cathleen Summers. With almost 30 years of experience, Kathleen's legal practice concentrates on elder law, crisis planning and management, Medicaid and long-term care planning, estate planning, and guardianship. Kathleen often serves as an advisor to local hospitals and as a member of several boards in the community. She currently serves as vice president of the Massachusetts chapter of NALA, the National Academy of Elder Law Attorneys. So Kathleen, thank you for hosting, and I'm going to turn it over to you.
Well, thank you so much, Carol. And again, thank you so much, everyone, for joining us. Obviously, this is a topic that really has been of great interest to so many of us. And we do find that information about what is available to seniors, both on a federal, state, and local level, really is not well understood. So one of the first things I want to just make sure everyone is aware is we did create what we call an ebook, and it's called Understanding Benefits for Seniors, Federal, State, Local Resources that are available. And this is an ebook that, along with other ebooks that we've produced, are available, and you can get through requesting through either Carol directly or through our website. So information that we think is really critical for people to understand. And today we're being joined by four phenomenal people. We really do, first of all, want to say thank you to all of them for sharing their knowledge in these different areas. And I want to give just a quick introduction to you all about our panelists, who they are. And again, Carol's going to make sure that you all have their contact information afterward in case there are specific questions, concerns that you'd like to reach out to them about regarding your own situation. So dealing with our Social Security issues today is Anthony Bartlett. Anthony has a lot of initials after his name: CHFSC, CASLE, AEP, RICP, and he's a registered principal and CEO with Bartlett Wealth Management, where he specializes in wealth management. He has been advising clients on retirement distribution strategies since 1991. He's served as national president of the Society of Financial Services Professionals. He has worked throughout his career in developing strategic partner alliances with CPAs and attorneys, and he has championed the importance of income for life planning and pre and post retiree marketplace. He has spoken at Fortune 500 companies and conducted hundreds of seminars on retirement, estate, and asset protection. He's an active member of his community, and Anthony makes his home in Northbridge, Massachusetts with his wife and 3 children. Regarding our Medicare area, we have Peter E. O'Neill. Peter is certified as a no-fee Medicare planner. He has 33 years as a licensed employee benefits individual. He has 20 years as a certified senior advisor. He's also certified in human resources, and he's worked for Charter Financial Group and provides Medicare and Medicaid support plans and planning, long-term care plans, financial expense plans, and financial plans, and he'll make house calls. We also have today, for our veterans benefits, Patty Servaes. Patty Servaes is a VA accredited agent and has been assisting veterans and their surviving spouses with their VA pension awards since 2005, when she founded Elder Resource Benefits Consulting. She started her career as a CPA at Price Waterhouse, and she has worked for the Boston Globe and the New York Times, which has proven invaluable in navigating the complex government paperwork required for a successful VA pension application. We also have Cristina Oliveira, and she has over 20 years of experience working with older adults. She began her career at the Marlborough Senior Center as an outreach worker, working with the Portuguese community. After 3 years in this position, she was promoted to the outreach coordinator, and she oversees social services for older adults, as well as case management and client support. She was also the interim director at the Marlborough Senior Center, and she was involved in all aspects of running that center. Today, she's employed with the Sudbury Senior Center and has been there for the last 4 years as their outreach information specialist. She provides social services, information, and referrals, and assists with public benefits. She's also a Shine counselor and runs the low vision and caregiver support groups. She's also written a grant in order to reach out to the Chinese population in Sudbury. Cristina is a member of the dementia-friendly Sudbury Action Team, and she enjoys working with older adults and giving back to the community. So again, thank you to our 4 panelists for joining us today. And let's go ahead and begin with Anthony to talk about Social Security.
I thank you, Kathleen and Carol and Phil. Thank you so much for the opportunity. And I think you guys are doing great work, yeoman's work, communicating out to the individuals and community. I'm often asked about the history of Social Security. So I'll give you a little background on that. I'm going to talk a little bit about how you should think about deciding when to start Social Security, what happens if a spouse predeceased another spouse, and survivor benefits. Talk a little bit about age gap differences between spouses and some of the claiming strategies around that. And then I'll also talk about, can you work and still collect Social Security? So just as a backdrop, Social Security was signed into law August 14th of 1935 by President Roosevelt. And it was really an extension of what happened with the Great Depression in the need to try to provide some type of benefit, social benefit for individuals that reached 65 and older. And it's interesting, the very first recipient of Social Security was Ida Fuller. And Ida started her Social Security benefit January 31st of 1940. She contributed from 1937 to 1939, and she made a collective contribution into the Social Security system of $24.75. And her first check, January 31st of 1940, was for $23.54. And during her life, she ultimately collected $2,484. So contributed $24.75 and ultimately collected $2,484. And in 1939, they added the survivor benefits. 1956, they added the disability benefits. And in 1981 was really the transition of the Social Security system as it was known then, and now how it's known today. And for those people who are government employees or state employees, this is when the change occurred on benefits that you pay into the Social Security system and benefits that you might be eligible for as a government or a state employee, often referred to as the WEP, W-E-P, or the GPO, government pension offset provisions. In order to be eligible for Social Security, you have to have at least 40 quarters of income that you've paid into the Social Security system. And for disability benefits, you have to have 40 quarters, but you need to have at least 20 of those in the last 10 years worth of earnings timeframe work. Taking Social Security and trying to determine whether or not you can start at the earliest age 62 or the latest that you can defer until age 70, I think is really an individual or a couple's decision. The earlier you start, the less you receive in benefits from a pure dollar standpoint. And the later you defer till age 70, you get an increase. And the difference between starting at age 65 and age 70 is about an 8% per year increase. So I think it really matters based on family health, other financial resources of when you ultimately decide to turn on the income. When people are receiving Social Security benefits and a spouse dies, the Social Security system looks at the collective income based on the two beneficiaries of the Social Security system. So I'll share an example, true example with my parents. My father worked outside the house. My mother had the hardest job taking care of the children. So when my father retired, he was eligible for $1,500 from Social Security. My mother didn't have as many of those credits. Remember, as I said earlier, you needed to have 40 credits. So her benefit amount was around $320. And so the system says that the lowest wage earner spouse will receive at least 50% of the higher spouse's Social Security benefit. So for my parents, my father was receiving $1,500. My mother was receiving $750, so 50% of my father's benefit. And then when my father passed away, my mother was eligible to get the higher of the two, not collect both. So her Social Security benefit went from $750 to $1,500, but again, she did not also continue to receive her $750. So survivor benefits are there. If your benefit is lower than the spouse who passed away, you would get an increase. If there are no living spouses, but there are children, children are eligible for benefits. If they're underneath the age of 18, or if they are in college and underneath the age of 22, and that also applies to parents who might have adult children with special needs, that if the special need event or occurrence started prior to age 18, that adult child would receive benefits post age 18, or if the disability occurred while they were in college and underneath age 22. Taking and looking at claiming strategies based on age, remember what I said. The earliest you can receive benefits is age 62. The latest you can defer is age 70. So very often when we have a disparity in ages between spouses of a 5, 6, or 7 year period, it's important to look at the implications of claiming off of a older spouse's record if the younger spouse is younger than age 65, because we have some reduction in benefits because we're electing early. I'm often asked the question, can you continue to work and continue to collect Social Security? And the answer is yes, as long as you are 65 and older. Social Security does not care how much you earn. You're still eligible for your full Social Security benefit. However, if you're younger than age 65 and you start your Social Security benefits, there's going to be an earnings test that will apply. And that means that if you are continuing to work and you are making more than $18,920, and that's in the year 2021, it gets adjusted every year, for every dollar above that $18,920, you would get a $1 reduction for Social Security benefits for every $2 above that. That applies to widow benefits, and it also applies to divorce benefits. If you are widowed and your marriage lasted for greater than 9 months, you're eligible for a widow benefit. And if you are a divorcee, you are eligible for benefits based on your ex-spouse as long as your marriage lasted for 10 years. So that's the quick overview.
Anthony, if I could real quick, there is, Social Security does have a website, correct? SSA.gov.
Correct.
And this is a place where people can sign on and get information about their particular expectations for Social Security benefits, correct?
Correct. Yes. SSA.gov. You can register for an account. It's very easy. I do tell people, though, that if you have some type of identity lock, if you are a LifeLock or something like that, and then you're trying to register, they will not allow you to register. You basically have to call into the Social Security system. They'll ask for some security questions, and then you can then register through your socialsecurity.gov site to get benefits. And it's incredibly important to get the benefits, Kathleen, to your question and to your point, because the benefits that you are receiving are based on the reported earnings throughout your working years. So it's important to make sure that the system is recognizing your true earnings. Sometimes it doesn't keep track with the actual earnings. And so if there's a disparity, it's important to keep track of that and then notify the Social Security Administration of the discrepancy.
Fantastic. Thank you, Anthony. That was extremely helpful. Peter, if we could go ahead and now talk about Medicare.
Great. Okay. So what I'd like to do today, this is an educational only program, which means that I won't reference any carrier. It is a regulated presentation. So that is part of our disclosures that we will simply talk about Medicare. Anybody who needs additional help, certainly we can talk with them on in person as well. So be quickly on what is Medicare? What are the A, B, D, and C's in Medicare? We will reference that to Massachusetts. What are the eligibilities for Medicare, and how and when to enroll? Next slide, please. So Medicare, as many of you know, is a federally required health insurance plan. It's actually supported by the state of your residence, and it changes by the state of your residence. So should you move, be aware you will have to make some changes on your Medicare plans. Next slide, please. So Medicare is made up of letters. In many states, there are lots of letters. In Massachusetts, we will focus only on A, which is your hospital insurance, B, the medical part, outpatient, doctor visits, D, which is your prescription plan, and Part C, of course, is called Medicare Advantage, and then there are Medicare supplement plans as well. The last two are not mandatory, but they are good suggestions to look at once you get into Medicare. Next slide, please. So eligibility, anyone who is 65 or older, if you're a US citizen or a legal resident of at least 5 years, if you're under 65, you must have a qualifying event and be on that qualifying event for 24 months. On the 25th month, you will automatically receive Medicare. Anyone who has end-stage renal disease or Lou Gehrig's disease at any age is automatically enrolled into Medicare. So how do you enroll in Medicare? Well, if you're receiving Social Security benefits before the age of 65, you will be sent the card automatically. Generally about 3 months before you turn 65 is coming in the mail. If you're not receiving benefits, you can go online. You can make a phone call to Social Security. They will set up an appointment for you and then enroll you. There is also the options of making an in-person appointment, although at the moment with COVID, they are not taking that as an option, but those options were available. Next slide, please. So what do you receive from Medicare? This card is what you'll receive. It will have your name, a special identification number. If you've known parents who had a Medicare card and they got to change, it's because they used to use Social Security numbers. They don't do that anymore. You'll have a Part A with a date and a Part B with a date. They sometimes will match and sometimes they'll be off, but that will be your actual card to use for the rest of your life. All right, so Part A. Part A, there is no premium for most people. As long as you or a spouse work for 40 quarters, Part A is free. It is your hospital card. It is set up as a per incident policy, which means that if you had 2 claims in a year, you would have to meet that deductible twice. For this year, it's $1,484. So the first 60 days of being in Medicare, you won't have any copays of covered expense. I don't tell you you won't have expenses, but you won't have any copays of covered expenses. Days 61 to 90, you will start paying on a per day basis. And this year it's $371 per day. You start staying there beyond 90 days, you're going to pay $742 per day. And then beyond the reserves, which is an additional 60 days, you're actually going to be responsible for all costs. Hence the reasons why you may want to talk with Generations Law Group, because that's called Medicaid planning. Hopefully that doesn't happen, but that's how Medicare A part works. Next slide, please. So it also covers the nurse, rooms, meals, home health services, blood and hospice, and it actually covers some nursing home and rehab, but it is not long-term care like a long-term care policy would cover. Next slide, please. What it will cover in a nursing home or rehab, and it means that you're either going to get better or stable for them to keep you in these facilities because they do want you out. The guidelines are is you must have been admitted to the hospital for 3 nights or more. It's not an observation. You must be admitted. First 20 days, you will have no copay. Days 21 through 100, you'll have $185.50 copay. And after day 100, you will start paying full costs, therefore depleting any of your assets or any of your resources. That's how the Medicare Part A will work for you. Next slide. So Part B typically is a premium. For most people, they'll pay $148.50 a month. For those who are making in excess in Massachusetts or in federal for an individual of $88,000 or over $176,000 as a couple, you will pay an IRMA tax. It's an extra fee. It is based on your taxes of 2 years ago. So for this year, they're using 2019. There's a $203 annual deductible. They do cover doctor visits, outpatient care, lab tests, screenings, durable medical equipment and supplies, but it is an 80-20 split from most services with no cap. So regardless of how high the bill is, Medicare is going to pick up 80%. You'll be responsible for 20. Okay. So what's not covered under what they call original Medicare? Well, eye exams, eyeglasses, routine that is, routine hearing test and hearing aids, routine dental cleanings and x-rays, private duty nurses, over 100 days in a skilled nursing home, and even prescription, again, that's covered by Part D. In hospital, prescription is covered, at a doctor's office administered is covered under B, but this is the traditional, outpatient type of a prescription. So, okay, next page. All right, so you got your federal part taken care of. Now you have to make some decisions, and that's where the state of Massachusetts comes in. Option 1 is looking at a D card and a Medicare supplement policy. Option 2 would be called a Medicare Advantage plan, and I'll go into the details of each of those. Next slide, please. So the federal government does not send you a drug card or a D card. It is mandatory by the federal government. It is state driven and it's privately designed. So just know that Medicare does pose a penalty if you don't have a drug card. The way it's set up is typically there are 5 tiers that drugs are classified under. It helps cover your at-home prescription costs. Again, it's managed by Medicare. The state is the one who's designing which plans are available for the residents, and private carriers offer it. There are 26 here in Massachusetts, 26 different plans. The premiums and copays and deductibles vary. It does matter what you take. It does matter where you get your medication. We do help people design the plan that's best for them as well. In 2021, the standard deductible for a drug card is $445, but that does not need to be satisfied if your medication is a tier 1 or a tier 2. So meaning that the tier 3, tier 4, and the tier 5 medications will have a deductible and then some type of cost sharing. Okay, so now you're compliant with Medicare, A, B, and D. How do you cover the gaps that Medicare is not covering? Well, one of them is to look at a Medicare supplement. Here in Massachusetts, we have 2 plans. One is called a core and one is called a supplement 1A. If you were born in 1954 or before, you will have an option of having a supplement 1. And the difference between a supplement 1 and a 1A is that a supplement 1 has no deductibles to satisfy for A and B. A supplement 1A has a deductible of $203, which is your B, and then the rest is being covered. It's obviously been designed to lower your gap costs as Part A and Part B. But it's important to understand it's a mirror of A and B. If your Medicare plan isn't covering something, then typically your supplement isn't covering it either. It's obviously, again, approved by the state and offered by private insurance companies themselves. Okay, that's all right. So the next side, if that plan isn't appropriate for you, you'd like to have a little extra benefits as well, or maybe some monthly costs, we can look at what's called a Medicare Advantage plan. Next slide, please. So again, approved by the state, it's a Part C plan. So again, the letters of A, B, D, and C are now being revealed. Part C is a Medicare Advantage. It's approved by the state. It's really a network of PPOs and HMOs, which most of you certainly should be familiar with. It's a one ID card program. So you no longer use your Medicare A and B card or D card because it's all included on that one card. And these are the ones that you see advertising for the extra benefits, such as dental, such as vision, such as hearing, such as even fitness programs. You know, Joe Namath was big about doing that, obviously, this past October through December. Next slide, please. Okay, when do you enroll? So as you're turning 65, it's called your initial enrollment period. That's the 7 months you may have heard about. 3 months before your birth month, and 3 months after is a period when you can sign up and again, not be imposed with any kind of penalty. You don't have to sign up for Medicare under certain circumstances, so don't feel that you are going to get a penalty if you miss this. It does matter what other insurance you have when you're turning 65. All plans go through an annual enrollment period. That's when you see the heavy advertising, the October 15th to December 7th. That's when people look at going from original Medicare plan to a Medicare Advantage or a Medicare Advantage to original Medicare. And those all start effective January 1st. The general enrollment period is for, if you've missed certain dates, you can still get into Medicare. It's January 1st through March 31st. However, your Medicare will not be effective until July 1st of that year. Open enrollment period is going on right now for people who have Medicare Advantage plans and either want to switch back to original Medicare or change their Medicare Advantage plan to another plan. They can do that one time during this period, and then they're locked in for the remainder of the year. And then there's special enrollment periods. That's when you may have lost your job, your health plan has changed, and you're over 65 and you want to look at Medicare, you can enroll in Medicare at that point. As long as you can have a qualifying event that Medicare allows, you can get into Medicare at any point during the year under those circumstances. Next slide. So you'd heard of penalties, and they do come up. I want you to understand they are not devastating. They will not bankrupt you, but they will irritate you because they are permanent. So if you miss deadlines and you do not have a qualifying event because of it, the federal government will add an extra charge to your plans, and it will come every single month. So my number one recommendation is don't be late. And that's your brief introductions to Medicare. We'll take some questions after as well, of course. And thank you for your time.
Thank you so much, Peter. That's incredibly helpful. Medicare is such a complex area, and really understanding what the benefits are that people have under the different plans is critical. So thank you for that information. Patty, if we could, we're going to move forward now and talk about VA benefits.
Okay, great. You got the slideshow? There you go. Okay, my name is Patty Servaes. I'm a VA accredited agent. That does not mean I work for the VA. I do not. It's very similar to when you hire an accountant to help you with your taxes. Just because they're a CPA doesn't mean that they work for the IRS. They work for you. So let's go to the next slide. So one of the reasons why we think that you should work with Elder Resource Benefits Consulting is that we do not have any financial product sales. We are focused on VA regulations and getting you the VA benefit as quickly as possible and as soon as you are eligible for it. Our average time to award is less than 4 months. The VA tells you to expect 12 to 18 months. So that 4-month average is something we're really proud of. And we pioneered the accrued benefit portion of it, meaning if you pass away before the VA grants your benefit, we've been successful getting the VA to pay the monies due out to family members or even to the community that they were living in some instances. Next slide. So, the other thing I want to say is this benefit has been around since the 1950s. They did a major overhaul on the benefit in 2018, and there is nothing on the horizon that we can see that would indicate that they're planning on doing away with this benefit. It can have a big impact on your family. We're going to go through a quick example. Let's say that you were a claimant who had $100,000 in assets and you had monthly gross income of $3,000 and a monthly facility fee of $5,000 and no other expenses. You would have negative $2,000 every month, and $100,000 would be gone in 50 months or 4 years. But if you were getting the VA benefit at the maximum rates, it really extends the amount of time those assets would last. So for example, the maximum rate for a surviving spouse is $1,244 a month, which now changes your negative from negative $2,000 to negative $756 and allows your $100,000 in assets to now last you 11 years instead of 4 years. Game changing. A well veteran with an ill spouse can get up to $1,519 per month, changing the amount of time their money will last to 17 years. A single veteran at 1936, it takes away almost the entire $2,000 negative, letting the assets last for 130 years. And in our married spouse example, where the married spouse maximum amount is $2,295, you get yourself into a positive cash flow situation and your assets could theoretically last indefinitely. So how do we get this money? Let's move to the next slide. There are 3 main criteria that you have to pass in order to get this VA money. Step 1, you have to pass the military criteria. Overview of the military criteria is you have to have served at least 1 day during a period of war, at least 90 days in total on active duty, and have been other than dishonorably discharged. That 90 days on active duty changes to 2 years or the period for which you were called up active once we get to the Gulf War. It's important to note that National Guard and reservists only are eligible for this benefit if they are called up to active duty. It is an active duty benefit only. And the surviving spouse must have been married to the veteran at the time of his death. Starting on November 1st of 1990, if the surviving spouse remarried, she must use the service of the person she remarried. If she was married to somebody before November 1st, 1990, who died, and she remarried somebody and they died before November 1st of 1990, or they divorced them before 1990, we can go back. The second step is the medical criteria, and we'll go through that in a minute. Custodial care is the main word. And if you pass those first 2 steps, then you can move on to the third step, which is the financial criteria. Let's go to the next slide. So this next slide details out the periods of war. I'm not going to go through it because I want to be mindful of the 10-minute time limit. It's just very important to say that you should not listen to the know-it-all neighbor next door when it comes to what the periods of war are. They are not the periods on the History Channel. They are periods that are set by Congress for this benefit. You can see them on my website, elderbenefitsconsulting.com. And I think that they said they were going to share some of the information with you. I see need to fix this slide a little bit. My slide software updated. Every time they update software, it never seems to help me. Okay, next slide. So assuming that you served during a period of war, I like to say it's no longer a yes or no benefit, it's if and when. So as long as you meet the military criteria, it comes down to when you need custodial care and when you meet the financial criteria. So the VA says, in order to deduct your monthly facility fee, you must require custodial care. And this was a very clever way to try to confuse people so they don't get the benefit. Because in the normal elder care world, custodial care means nursing home care. And in the VA world, it does not. In the VA world, custodial care is defined as needing regular supervision due to physical, developmental, or cognitive disorder, or needing the assistance of another person with at least 2 activities of daily living. Next slide. So what does this mean? What this means is if you're going into assisted living or independent living and your doctor says, hey, they need to live there. They're no longer safe to live alone at home. Boom, you've met the custodial care requirement. My favorite example of this is I had a family member call me. Their dad had emergency moved into an independent living. And when I was asking him about the care needs that the dad had, he just kept saying none. And I said, but I was told this was an emergency, that you basically drove up to the independent living facility and said, he needs to live here. I can't take him home. What happened? He said, oh, I went to go and visit him. He made lunch for me. He served me a rancid ham sandwich on green moldy bread. I said, aha, that is not fine. That needs regular supervision because he's eating spoiled food and would be failure to thrive. And of course, if you're getting assistance with bathing, dressing, etc., you're in our custodial care column. So what this means, next slide, is pretty much everybody who, I was skipping this slide as too, but I can talk to it. So basically what it means is everybody in assisted living or nursing home is going to qualify for this benefit. They're going to meet custodial care or need the assistance of another person with at least 2 activities of daily living. It's our independent living people where it can sometimes get a little harder. For independent living, the independent living facility must have 24-hour people on site. It can be the security guard, but it cannot be that you're basically living in an apartment building and there's nobody there if somebody needs 911 to be let in overnight, right? So some independent living communities, they lock the door and they go. And if you need 911, you call 911, and then how do they get into the building, right? They have to call somebody to let them in. That would not qualify. Most independent livings are not that way. Next slide. So if an independent living person meets the custodial care, then they would be able to get it. And somebody was living there. And like I said, most assisted living and nursing homes, nursing home always qualifies. And then if you're getting home care, same thing. If you need regular supervision or if you're getting the assistance of another person with 2 activities of daily living. If you meet those, we get to go to the next slide and the next step, which is the income test. It's a 2-pronged financial statement, financial test, an income test, and an asset test. So you have to pass both. So what's income? Next slide. The VA says if your income, your monthly gross income is less than the VA benefit, you pass the income test. Well, here are our maximum pensions for the year. Somebody in Massachusetts looking at this is going to say, what? My dad has more than $1,936 a month coming in. He has too much in income. He's never going to get it. But wait, that's not how it works. The VA's definition of income is everything we think of as income: Social Security, pensions, IRA distributions, annuity distributions, minus regularly occurring unreimbursed medical expenses, which include home care, assisted living, independent living, nursing home, as long as you met the medical test. And you also get to deduct medical insurance premiums, and your Medicare premium. Next slide. So as you can see, if you are a surviving spouse and you have income of $3,000, a facility fee of $5,000, your income for VA purposes is negative $2,000, and you get the full benefit. And then in the next column, where again, I was again foiled by my upgraded software, you can get a partial benefit. And what is supposed to be showing on there is that, let's say that your income was $6,000 and your facility fee was $5,000, you would be left with VA income positive of $1,000. And then basically what the VA would do is minus that $1,000 from the maximum benefit you would get and give you the difference. Not a bad deal. But that $12,000, because it gets even better, that $12,000 that you left on the table is now a flexi spend type of account for you. And you'd be able to say, hey, I bought $500 glasses. Hey, I got a new wheelchair. I bought Band-Aids. I got Kleenex. Anything that's medically related, you would then be able to submit to the VA and they would say, oh, well, let's say you totaled up $6,000 in prescriptions and doctor copays and new eyeglasses. Oh, well, that $6,000 is less than the $12,000 we have sitting waiting for you. So here's your extra $6,000. Next slide. So your assets must be less than $130,773 in 2021. This amount goes up every time there's a cost of living adjustment. There is a 3-year look back period for transfers. However, it does not work the same way as Medicaid. It is much easier. Next slide. So when people talk to us, let's say, for example, somebody called us and they had income for VA purposes of $3,500 negative and total assets of $160,773, they'd be $30,000 over assets. We'd do the math and tell them, hey, you don't have to do anything. You can just wait and you'll be eligible for benefits in about 8.5 months. Or you could transfer that $30,000 to a child and you'd be eligible in 5 months, or prepay your funeral. Maybe you own a home, which doesn't count as an asset for VA benefits, and you can fix something up in there and get your get your assets down to the $130,773 and apply the minute your assets are that low. Next slide. So assets. Everything counts as an asset except your primary home, your possessions, your car. And what's great about your primary home not counting is even if you rent it out, it does not count as an asset. We would have to work the income into counting, but the house would not count. And so that can be a nice way to try to protect your house for your children. And get you a little extra income to help you pay for your assisted living or your nursing home. If your house is on more than 2 acres, the extra 2 acres does count. Okay, that's it. This is just a recap. I know I've already used my minutes. So
Patty, thank you so much. And the discussion that you had regarding the planning and how important the planning can be, and tailoring that with Medicaid planning that we often do, really can help to provide a large array of benefits for somebody when they're staying at home or in an assisted living facility.
Absolutely.
I would like, if we could, Anna, if we could go ahead with you. I don't want to lose your part of all of this. And so I'm going to go ahead, quickly go over the Mass Health part, and let's introduce you, if I could, Anna, to talk about local benefits that are available for everybody.
Okay, good afternoon, everyone. I'm Cristina Oliveira, the Sudbury Senior Center Outreach Specialist. And I'm just here today just to talk to you a little bit about the services and programs available throughout the Senior Center. Yeah, so I'm just gonna just go over the Sudbury Senior Center mission. We support the dignity, independence of Sudbury older adults with advocacy, education, and provisions of supports and services that address the intellectual, physical, and social needs of people growing older. So I just kind of want to talk about some of the programs that, even though, with COVID, we offer so many different programs, but I just try to cover the one that we are offering, virtually. So we have the lifelong learning program, community education, music, entertainment, fitness classes such as Tai Chi, yoga, watercolor, and special events. Unfortunately, our special events has been done, over Zoom, and also we've been doing grab and go, outside, which we get to see a lot of familiar faces that we miss seeing so much during the COVID. Yeah, and then other services, free consultation and information about all kinds of services. People would call us, requesting information. How can I get, a list of home services in the area? So we provide them with a whole list of all the options in the Metro West area, public benefits. I can also help, with the application process, about on the public services. We run support groups, and right now, again, it's been done virtually, low vision and caregiver support group. Senior Center is also an intake site for field assistance, which it's a great benefit that I see that a lot of people in Sudbury does not take advantage of, because it can help you with your heating bills during the winter time. So I think some people, they feel like proud, but it's a program that can really help during the difficult time, especially now, with people losing jobs and things like that. So it's a great program. And again, we are one of the intake sites, so I can help people through the application process, which sometimes it can be overwhelming, but I always tell people, just don't give up. Start the process and just finish, and then it'll be done. And then you get the benefits. So I love helping people access the benefits that's available. And that's also with the SNAP program, it used to call the food stamps. In the SNAP program now, you just use like a debit card. So nobody needs to know that you are using, a SNAP program. So it's another great way for people that it's struggling financially to access, food and maybe save for other things. And also Shine. Shine, it's a great program. It's train Medicare volunteers that assist people navigate the Medicare system, which a great presentation was just given about Medicare. But if anybody needs assistance just navigating the Medicare system, choosing your supplement, your Advantage plans and your Part D, and also, helping in the Medicare, when you turn 65, signing up for Medicare, because there is a lot of people that still, a lot of confused, when they become 65. So that's another great program that we offer. We have 2 great Shine counselor that they offer 3 hours of their services at the Senior Center twice a week. And I'm also a Shine counselor, but I'm just a backup Shine counselor because I do so many other things. So I don't like to take away from our volunteers. So I only help them when they're really overbooked. Legal clinic, we have 3 great elder law attorneys that provides our free consultation on a monthly basis. And Cathleen Summers happens to be one of them. And it's a great program. It's just a great way to, if you have like a quick question about legal issues and things like that. And also if you need to know, where you at with all your finances and, and things like that. So it is a wonderful program that all the 3 elder law attorneys offers to a Senior Center. So AARP taxes, it's another program that we work with AARP, and they provide free taxes. So it's just about, they're just gonna start next month, February 4th. That's the date that people can start calling the senior center to schedule an appointment for their tax to be done at the senior center. And we are using all the precautions, and we're going to have like a whole system just to find a way that it's going to be safe for people to come in and do their taxes. And we did it last year and it worked out great. The last year we did it in, it was June because the tax got extended. And this time we're going to be doing, you know, during the winter. So we just have to find a way not to keep people outside waiting. So people will be able to come inside with the tax worker and get their taxes done. Next slide. Yeah, and then we have a lot of different wonderful volunteer programs. And I'm just going to mention again, just the ones that it's active right now because of COVID. We can't allow volunteers to have, you know, in-person contact with anyone. So we just provide in the medical equipment loan closet, you know, where someone can get a walker, a cane or a wheelchair, or, you know, those are the types of medical equipments that we loan. And people are able to keep the equipment until, you know, until they no longer need it. So, and then they give it back to us again, and we make sure, you know, clean the equipment so we can loan to other people. Phone Buddy, it's just a wonderful program that it really helps older adults in their homes that does not have any family members, because the participant will get a weekly call from a volunteer just to check in on them, make sure how, you know, how everything's going, and kind of have like a conversation, just a normal conversation about anything that they would like to talk about it. It's just, I just love the program. And we have a great volunteers. A lot of volunteers has been showing a lot of support during COVID. And the shopping assistant, it's also another great program for homebound older adults that has no way of going to the store. And also there is a lot of older adults because of COVID, they have decided not to go into the stores because it's just so tricky out there right now, you know, with COVID. So they don't have the volunteer does not have contact with the person. So they leave there is a list that is left on the door with a gift card. The volunteers go out, do the shop and come back and bring everything to their doorsteps. So it's been working out great. And we have several people taking advantage of this program. Sand bucket delivery, it's, you know, you can call the senior center, request to have a sand bucket delivered to your door. And then you can get as much as 2 sand bucket. And then when you're done with it, you can just request for more. And that's also, you know, no contact, you know, to get that done. Lockbox, it's there is a lot of advantage of getting a lockbox, and we work with the fire department to work on this program. Actually, the lockbox and also the home safety checks. It's a program that we work with the fire department to do it. You provide a key to the fire department, and then they go in and they make sure they get the box done, and then they keep that key in a secure place inside of their fire truck. So in case of an emergency, they have access to your home, you know, in case you fall and you're not able to get up, you know, and things like that. Home safety checks, they just go into your home and they check, you know, for fire alarms or any other problems that you might be having in the home that might be, you know, a safety issues. And also we have a lot of different opportunities for, you know, volunteers that wants to take part in the senior center, you know, just helping other people. So I hope I'm not going too crazy, too fast, or because I'm so afraid of the time. But
No,
you know.
no problem. And if we could, we do have a few minutes more, and I know we're getting up against our time. I would like, if I could, just to ask you to just talk quickly about the transportation program. And I know we have a quick one about some tax things, and then we're going to go ahead and take some questions for people. If people do need to drop off, we do understand that. But if you'd like to stay for a few minutes of questions, that would be wonderful. And I apologize. Go ahead.
Oh, no, it's fine. Yeah, so the transportation, the only program that we have established, it's the program in partnership with the Metro West Regional Transit that I'm very excited that we are starting up again in February because it was suspended due to COVID. So this transportation program, it's wheelchair accessible van services, which is available for residents who are age 60 and older, or who are 18 older with a disability. So that's kind of the program that we have right now. And also, I just want to mention that there is a transportation committee that they're working really hard to improve the transportation options in Sudbury. So that's something that it's in the works that I'm very excited about it. And they just had a program, it's called the Go Sudbury Taxis, just to kind of collect data to see what the needs are. So it's just, I just want to mention that they're working very hard to improve the transportation options. And I just have this slide about property tax relief options, just so people know that the assessor's office oversees several available property taxes exemptions for older residents, veterans, and others. So you just contact the assessor's office if you have any questions about any of the programs that it's listed.
Anna, thank you so much. One of the things that I do want to say too, Anna described a lot of, she's with Sudbury, but certainly all of the area council on aging have similar programs. They're an incredible resource for people to reach out to. And I recommend to our clients that they get to know the resources in their town, in their area before they need them, because they really do have an incredible breadth of resources to be able to provide, both at the senior center level as well as within the towns themselves for things like tax abatements, fuel assistance, those kinds of things. So thank you. Carol, if you would go ahead and we'll wrap things up.
Okay, well, let's get a couple of questions that have been in the chat box for a few minutes. So Anthony, you have a couple of questions here. If you are divorced and should you die before both spouses, ex and current, do both spouses have the ability to collect Social Security based on your income level?
Thank you. Yes, both can collect off of your record as long as the ex-spouse marriage lasted for 10 years and the current marriage for surviving spouse lasted for 9 months.
Okay. And then there was another one for you. It's a little similar. If both you and your spouse were working and both are claiming Social Security, what happens if one spouse dies? What happens to the two Social Securities they have been claiming?
So the Social Security system will look at the highest Social Security benefit. And if the person who passed away had the lower benefit, their benefit would increase to the higher benefit. If the higher benefit wage earner was the survivor, then their benefit would stay the same and not be eligible for the lower spouse's benefit.
Thank you. Someone's parents were married 25 years, divorced, and the father passed. Her father was a vet and was active during the Korean War. Is her mom still entitled to VA benefits?
You have to have been married to the veteran at the time of his death. So if you divorce the veteran, you divorce the benefit. However, we do see a lot of people who get back together when one of them is ill, and we have been successful with common law marriages, proving common law marriage after divorce. It can be tricky and depends on your state, etc. But for the most part, no. Her main hope would be to marry somebody else. Check their discharge beforehand.
Okay. And then someone else sent a request for their father's dates of service back in August, but haven't received anything. He's a Vietnam vet. and she'd like to help him get any benefits due to him. Do you have any advice on getting those dates for him so he can apply?
Sure. So one thing that's important is if you meet all the other criteria, there's no sense letting money just slip out the door by not filing just because you don't have the discharge papers. National Archives is behind because they closed during COVID, but you can call us and we can walk through the whole analysis with you, and then we can assist you in getting discharge papers in ways other than from the National Archive.
Okay. Thank you, Patty. There's another question. I think this one goes for Anthony. What if you started to receive full SSDI at age 57 due to a permanent disability? What happens to Social Security payments going forward when I become retirement age?
Great question. In most cases, the Social Security disability benefit stays the same when you are of retirement age.
Okay. Did I just hear someone has a question?
I do, Howard.
Okay, Howard, go ahead.
I have a question relative to VA health benefits. I do receive VA health benefits. Is my wife eligible to receive health benefits, even though she was not my wife when I was in the service or anytime soon thereafter?
Are you getting TRICARE? Were you in for 20 years?
No.
Then I do not believe so, although it's not my area of expertise. So I would recommend calling the Veteran Services area for Veteran Services Officer for your town.
And I just want to thank our speakers tremendously for their time and
Yes.
for all of you for participating today.